The Public Affairs Department of WALA Fox 10 presents your Social Security Report.
Thank you, sir. Good morning, everybody. May I come in? The other day, I started to say accosted by a friend, but I say approached by a friend with a most unusual question. He said, you know, all through the month of February, something was bothering me about something that took place in February that had a very special connection with Social Security. Now, what was it? I turned all the things over in my head, and I'd say, no, that wasn't February. No, that wasn't February. No, that wasn't February. Finally, it dawned on me. It was in February of 1940 that the first monthly benefit payment went out, and it went to a Miss Ida Fuller, a lady living in Vermont or Massachusetts, one of those New England states. And ever since February of 1940, every month, all those years, 60 years now, they have never missed a payday. And believe me, that says something for Social Security. Don't you think so? I said, yes, I think it certainly does. You know, it started out paying by check, and now we have the direct deposit. And little by little, we're getting to show about half the people getting their payments by direct deposit. But if there's anything that happened unusual in the month of February in connection with Social Security, it was the first of all the monthly payments that went out, and those monthly payments have never missed a payday over all of those 60 years. So that's why I always say, these people who have a death wish for Social Security, I just can't understand how they come up with that. But let's take some of those questions and answers to come in with Social Security. And the first one that came in that I thought was very, very unusual this past week was this good lady who said, is it necessary to file for your Medicare way ahead of time? I can remember some years ago where they used to say, file for your Medicare 3 months ahead of your 65th birthday. Well, why is it necessary? You're not going to get anything, are you? And the answer is no, you're not. But at that time, you know, they were not quite sure that they were going to get people enrolled in time, but now they are. You don't have to enroll way ahead of the time of your 65th birthday. You can wait until the very month ahead of your 65th birthday. Now, don't wait any longer than that. Don't wait right up to the month of the 65th birthday. Of course, you can, and it can start with that month. But I would say enroll for your Medicare the month ahead of your 65th birthday. Now, you can enroll 3 months ahead of the time if you wish, or 2 months ahead of time. But I would say 1 month ahead of the 65th birthday month is ample. And this good gentleman had this question. He said about 3 or 4 months ago, I filed for early retirement at age 62, and my payments have started now. I have no complaint whatsoever about that. But I wonder, where is my Medicare card? Isn't that supposed to come if I've collected Social Security? No, the answer is it's not supposed to come with him, because you see, he is collecting early retirement. You don't get Medicare coverage until you're 65 unless you're drawing Social Security's disability benefits for as much as 24 months. Those are the only ones that get Medicare coverage before age 65. So even though you're drawing Social Security, you're drawing ahead of the age of 65, you're not going to get the Medicare card or Medicare coverage until you reach the age of 65. And this good lady wanted to know, if a widow is disabled when the husband dies, or she becomes disabled a little later. How young may a disabled widow be and start drawing the Social Security disabled widow's benefits? Well, if she has young or disabled children, age doesn't matter. But if she doesn't have young or disabled children in her care, she may be as early as age 50 to draw benefits as a disabled widow. So please keep that in mind. If you're not disabled, then you must be at least 60 as a widow. But if you are disabled, a disabled widow may file as early as age 50 and draw the disability benefits. But the clock on the wall now says you're disabled to keep any longer, you got to go. So if you will excuse me, I'll be back in just a few moments.
If you have questions or need assistance from the Social Security Office and are a resident of the Mobile area, please write to the Social Security Administration, Mobile District Office, 9 St. Emmanuel Street, Mobile, Alabama, 36606, or call 334-441-6165. Alabama, please write to the Social Security Administration, 150 College Avenue, Jackson, Alabama, 36545, or call 334-246-6018.
Thank you for admitting me again. You remember we were talking at the very beginning of this visit about the gentleman who had the question about what happened in February that was especially important in Social Security, and it was that first payment of the monthly benefits. Well, he brought up something else that I thought would be interesting. He said, by the way, how long has this Social Security business been around? And is this country the only one that has a Social Security system? Well, for the first part, you can find traces of something like Social Security way back in biblical times when the people were urged to take care of the widows and the orphans and the poor. And then you can trace it down through the Roman Empire and through the Ming Dynasty of China over in the East. But for the modern type of Social Security, I'd say that it starts in 1889 with the German system under Bismarck, 1889, and then it spread from Germany throughout all of the major nations, France, England, Belgium, and Spain and Portugal and the Netherlands and then many of the South American countries. But we were about the very last of all the major industrial nations to adopt the Social Security system. And you know why? Because we were a growing country. We didn't need it. We always had plenty of jobs. We were expanding. But around the turn of the century, the outlook began to change. And around that time, we began to see that we were going to have to start doing something to take care of the family. But the family breadwinner lost the job because of old age, because of disability, and because of death. So that's when the movement started toward what we finally saw as a Social Security program, which went into effect on the 1st of 1937. So 1937, January the 1st, 1937, is when our Social Security system started to operate here in this country. And it's been expanding little by little ever since then. But so much of that. Let's turn to another one of those questions that came up. This young lady said, I have lost my Social Security card. I can't find it anywhere. And I'm wondering if somebody finds that card, can they use it? Well, I guess they could. But if they use it to work under, they're building up credits for her. And it would be doing her good. But now there's something else that she's going to have to watch. If they start to use that Social Security card to establish credit somewhere, then it could begin to hurt her. So she better watch to see if any charges come in that she knows that she did not have anything to do with. And if it begins to look like it's going to be a problem, get in touch with the Social Security office, ask them to cancel that card, cancel that number, and issue a new number in her name, because it can be done, and it will be for her protection to do it. And I would strongly urge that she be sure to do that. And this elderly gentleman now was, well, he's not that elderly, but he was saying, back some years ago when I was a younger man, I was in the military. And I'm wondering, was that white covered by Social Security? Well, it certainly was. Beginning of the 1950s, military coverage is just the same as commercial and industrial employment. You don't have to worry about it whatsoever. Doesn't matter what the rank or what the type of employment in the military, or it doesn't matter what the grade, any of it. It's all covered just as though commercial and industrial employment is covered. So anytime he wants to check on that, get in touch with the Social Security office and see that that has been credited to his Social Security account. And this good lady was a bit concerned about this. She said, my doctor is referring me to a very fine specialist out in Texas for a most unusual operation. Now, I'm wondering, since all of my work, and all of my life for that matter, up to this point has been in Alabama, and I've paid all of my Social Security taxes here in Alabama, is Medicare going to do anything for me when I get out there in Texas? Well, the answer is yes. Medicare will follow you from Alabama to Arizona to Minnesota to Maine, anywhere within the 50 states or the United States possessions. Because as I've said so many times, Medicare is a national coverage. You don't have to worry about the fact that you work here and you're going to be able to use it over here. Of course you'll be able to use it over here, because anything that comes from here goes into the central office here and is there for your credit at any time that you're going to have to use it. Here, 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 here. It's there waiting for you. So she doesn't have to worry at all about the fact that it is going to be there for her convenience, for her use, and it will be just the same as though she were in Alabama. Now, this good gentleman has something that comes up, very rarely now, but it comes up occasionally. He said, when I reached the age of 65, I wanted the coverage of Medicare, but I wasn't ready to retire yet. I was continuing to work. But I could be billed for the Medicare, they told me, so I said, well, bill me. So I was covered. But now that I have recently retired, and I see they took out another Medicare premium out of my first check. But I paid twice. What do I do? Do you know the answer is nothing? Because you see, it takes a little while for this computer to talk to this computer, but it will. And this computer will tell this computer, look, we have already gotten the money for that particular month, so you pay the man back. So he doesn't have to worry about it. He is going to be reimbursed. But the clock on the wall says you can't be reimbursed for any more time. You've got to go. Thank you very much for letting me visit with you. And let me come right back in just a few moments.
If you have questions or need assistance from the Social Security Office and are a resident of the Eastern Shore, please write to the Social Security Administration, 368 Commercial Park Drive, Fairhope, Alabama, 36532, or call 334-928-2504. If you have questions or need assistance from the Social Security Office and are a resident of Andalusia, Alabama, please write to the Social Security Administration, 408 South 3 Notch, Andalusia, Alabama, 36420, or call 334-222-9701.
Back again. Thank you very much for letting me come back. This good gentleman said, my father was drawing Social Security, and he died just recently. My mother died, several months ago, but I'm the only survivor left. I'm 40 years of age. Is there anything that Social Security pays me now? I took care of all of the arrangements. I took care of the burial expenses. And I know that I did hear of a $255 burial benefit, and I've seen ads saying Social Security is $255 is not enough. You're going to need some extra burial policies to take care of everything. So I'm wondering, what can Social Security pay me now as the only survivor? Well, it isn't going to pay him anything. You see, that $255 lump sum is really not a burial benefit. It's called a lump sum death benefit. That's what it's always been called. And it will be paid for anything that you want to use it for. But it is payable only to the spouse living with the person who died, or someone who would be entitled to monthly benefits. For example, a disabled child or a minor child could be entitled to monthly benefits. But it has to be someone entitled to monthly benefits based on that account. Otherwise, nothing is going to be paid when that person dies. And this comes from a person who says, is it true that a parent of a person who worked and died after working under Social Security can draw monthly benefits from that working child's account? And the answer is yes. If the parent is at least 62 years of age and was chiefly dependent on that child, at least in the last year before the child's death. Well, when I gave that answer, he wanted to know, well, what about if the child retires and the child doesn't have any other dependents except the parents? Can't the parents come in and file as a dependent and draw benefits on that parent, on that working child's account? The answer is no. It was not set up for retirement. It's set up only for death benefits. And remember, it isn't until the parent reaches the age of 62 and can show that they were chiefly dependent on that working child in the year before the child's death. And when the child dies, then beginning with this 62nd birthday or thereafter, then that dependent parent may draw benefits of that working child's account. And this gentleman said, you know, when I reached age 65, they talked to me about taking the Medicare. I said, I don't want it. I've been in good health all my life. I'm not going to need any health insurance. But now that I have been retired for about 3 years, I'm beginning to find that I'm not quite the strong bull that I used to be. And I'm wondering, is there something that I can do about getting onto that Medicare? The answer is yes, there is. Yes, just around 1 month, not quite a full month now, that he can come under during this open season. You see, every year, January, February, March, is the open season for those who have failed to enroll during the regular time. And since he is one who failed to enroll when he reached the age of 65, or within 3 months after the age of 65, which is a grace period, then he has this open season of January, February, March. But don't let March go by, because he has to wait then until the next open season, which will be January, February, March of next year. And remember too, please, that when you file as a late enrollee during January, February, March, the coverage of the doctor bill part, we're talking about the doctor bill part, the coverage is not going to begin until the following July. Now, I've always emphasized the fact that the hospital part, the fact that you are 65, enables you to enroll for the hospital part, but for the doctor bill part, unless you enroll during the 65th period, that is 3 months ahead of the 65th birthday, the month of the 65th birthday, or that grace period of 3 months after the 65th birthday, then you're late. And you have to wait until the next open season of January, February, March. But the clock says you can't wait any longer now. You got to leave for a few moments. So will you let me leave for a few moments, and I'll be right back.
If you have questions or need assistance from the Social Security Office and are a resident of the Pensacola area, please write to the Social Security Administration, Pensacola District Office, 1011 West Garden Street, Pensacola, Florida, 32501, or call 850-434-5488. If you have questions or need assistance from the Social Security Office and are a resident of the Pascagoula, Mississippi area, please write to the Social Security Administration, 1225 Jackson Avenue, Pascagoula, Mississippi, 39567, or call 228-762-3370.
Back for that last roundup, with your permission. I don't know how some of these stories get around, but this good lady had heard the story that beginning the 1st of this year, they're charging now to replace a Medicare card that you have lost. She said, is that true? The answer is no. Social Security does not charge for any of its services. If you've lost your Medicare card, all you have to do is pick up that telephone. You can dial that toll-free number, 1-800-772-1213. Give them a little identifying information, and they'll be glad to issue that replacement Medicare card. So don't let anybody tell you that they're going to charge you for a lost Medicare card or a lost Social Security card. And here's an unusual one that comes up occasionally. This young gentleman said, they tell me that I lack 4 quarters of having enough coverage to be able to draw Social Security benefits when I reach retirement. Can I just pay those in? No, you can't. You can't buy quarters of coverage. You have to work them. You get in touch with the Social Security office and let them explain to you how simple it is to have those Social Security quarters of coverage earned. But the clock on the wall says now you've got to go. Thank you very much for letting me visit with you till next week. God bless you all, every last one of you, and goodbye.
This has been your Social Security Report, a public affairs presentation of WALA Fox 10. This program has been pre-recorded broadcast at this time. If you have questions or need assistance from the Social Security office, please call 1-800-772-1213.